throughout the morning.
All right, good morning, everybody. Thank you for being here. Appreciate your time. Tim and I are really excited that not only to be here today, but also that we're going to be with you, like Annie said, over the next 4 months. I think that it's important to pause and really pat yourselves on the back for this opportunity to work with the foundation. So I'm just going to spend a few minutes talking about Active Living by Design, so you're a little familiar with what we do and how we work. Here you see some of the sort of content areas that our staff represents. Tim has a background in social work, and public health, and I have a background in public health and nutrition. But we really draw on the expertise of our team. We meet regularly, so even though Tim and I are going to be the representatives working with you most closely, we go back and in weekly meetings we share and ask for advice from the other team members who represent planning, business, architecture, and these areas. I do want to mention too that at Active Living by Design, this is our mission. We really have a foundation of doing work that is led by the community. We've worked with community partnerships at different levels, so not just the local level, but also state and national partners. But the whole idea is that we want to help to spur and sustain community-led change that creates a culture of active living and healthy eating. And that culture of active living and healthy eating is so important because we're not just about coming in and doing an initiative or coming in and doing a program or providing a service. It's really about changing the way that the community operates on a day-to-day basis so that active living and healthy eating becomes the norm in that community. How do we do this? We do this in a variety of ways. Annie mentioned a recent long-term engagement that was funded by the Robert Wood Johnson Foundation called Healthy Kids, Healthy Communities. And that's where we really provided overarching support directly to communities, talked with them on a regular basis, and really coached them through individual work plans and action plans for healthy eating and active living. We work with funders, much like we're doing with the foundation here. Some of it is strategic development, helping them to actually shape their grant initiatives and influence their grant funding. Sometimes we work also directly with funders and being sort of a bridge and a support between funders and communities. We provide a lot of coaching and training to local coalitions as well as leaders. And we really feel like while we have the content expertise and we draw on evidence for what's successful around healthy eating and active living, that much of our work is about the process of community change and how do coalitions and communities navigate the change and deal with unexpected. I think anybody who's ever had an action plan knows that you can lay out what you're going to do over the next few months and then life happens. And you've got to do these course corrections and still be able to draw on best practices and evidence. And that's really where I feel Active Living by Design can help coalitions in navigating the process of change. So to date, we were founded in 2002. At that time, we were under the University of North Carolina at Chapel Hill. And most recently, as part of our own growth and sustainability plans, Active Living by Design has sort of gone out on its own just to provide us with more flexibility, to be more nimble in addressing the needs of the healthy eating and active living field. We're no longer with the university, but really appreciated that support from 2002 until recently. To date, we've worked in over 30 states across the country and with more than 160 coalitions and partners. And we worked at all levels, as I've mentioned, and this just gives you a sense of the different initiatives and places that we've worked. I do want to mention that we've also worked more intently in North Carolina. Since we are based in Chapel Hill, we've always felt a responsibility to make sure we provide service back to our own home state. So I think those of you who are from Caswell may be familiar with our Fit Community Initiative, because Caswell County was a grantee under that initiative that was funded by the Health and Wellness Trust Fund. Fit Community was one of our North Carolina-based initiatives, and we still have some active ones and some previous ones. So while these are not based in Virginia, we did feel like it was worth mentioning that we have experience very close by. So I'm going to hand it over to Tim to talk more about how we do some of our work and our models of change.
Great, thanks, Joanne. So, and anytime anyone has any question, feel free to raise your hand. Like we said, we want this to be conversational, and you might see behind us the bike rack, and you might be wondering what this is. This is our sort of internal cultural change to the parking lot. If you have any ideas that you want that we can't address right away, we put on the bike rack, maybe check in later. So in 2003, Active Living by Design came up with the 5P model. This is somewhat our logic model, and our response to the socio-ecological model. Is anyone familiar with that? If you've gone through some training, it's the really the idea of recognizing that there's change happening at all levels, whether it's the individual change, at the interpersonal change, community change, organizations, federal, state, etc. So, and we really recognize that all 5 of these are important to address in community change. And over the years, we recognize the importance of all of them, and we also understand that for sustainability reasons, a lot of our focus in the more recent past has been looking at policy change, the environment, and the systems, and the physical projects. Because whether it's an organization, a community champion, or even a short-term grant that an organization has, when all that gets pulled or someone leaves, the policies and the physical infrastructure in a community is what's left behind. That's something that we see as the longer-term change when you think about what it takes. Also recognizing that important components to get people to do with health behavior change, you need the preparation, promotion, and programs as well. So if you think about maybe, for example, safe routes to school as an example you can play out with all of these, where you need the infrastructure in place for children to safely walk to school. You need the policy or the incentives and the community champion at maybe a principal level to be on board with those types of things, as well as teachers. You need the programs and the awareness of letting the parents know that they could take an active role, etc. You can sort of see how these play out with different pieces. And when you looked at those maps of the North Carolina as well as across the country, what we see as the most successful partnerships that we work with have that multidisciplinary table, right? You've got people from all different sectors, similar to this room, when we just did introductions. And people learn each other's language, and you get on the same page about, okay, we're all wanting to achieve X goal, but in order to do that, we all bring a different language, we all bring a different expertise. Let's put together our resources and then try to work towards it. But we also recognize that it's not always as easy as that, right? Like, what brings people to the room? Sometimes there might be some funding that you're competing for with a similar agency at this table, right? And so it's all about transparency too, and recognizing that maybe you can pool resources. I like to think of this analogy like a potluck dinner. So you could have a whole room of public health people that might have a variety on the same dish, right? Your dish of skills. But when you have different sectors, you have a variety of different plates at the table. And then another way to play out that same analogy is everyone brings something different. Everyone brings something to the room. It wouldn't really be cool if you had a potluck dinner and a couple people show up every month or whatever, and they're not bringing a dish, but they're just taking. So it's sort of that give and take reciprocal relationship as well. And maybe that's not everybody at this table, and maybe that's not even everybody that needs to be here on the illustration, but you've got people from the government sector, the business sector, the people with the lived experiences, the parents, the youth, the people most affected by the changes that you're working towards, all sitting around making these decisions together. And again, another, in our experience looking at what's most successful, these are what we consider the key ingredients to that success. So regardless of even thinking about the strategies yet, that comes down the road, and we recognize that that's important too. But in order to get there, we really see these as the key ingredients to making that success. So I'm just going to read through these quickly because I think they are worth staying on for a minute. Meaningful community engagement. Really thinking about the parents, the youth, the residents, the people that typically don't always have a voice at the table, bringing that voice in, how to get them engaged. Intentional assessment and planning, keyword there is really around intentional, making sure you do it at the beginning, early, often, and throughout the beginning to the end. Collaboration, what you all are doing right now, being in this room, good example. Leadership, we see that as both internal leadership and external leadership, really building up maybe folks that aren't necessarily in even a formal leadership role, and how do you cultivate that so that when a couple of you win the lottery and you say peace out and you leave your role, there's someone that can easily be inserted into that position because you've built that capacity within. Peer learning, this is really thinking about what we're here to share a little bit about other communities that might look similar to the Danville region and what's worked there. It may not be exactly the same, but to share those lessons learned. So Carrie Peterson, who we work with in Omaha, something that she likes to say is, we've stole every best practice from somewhere else. And just sort of recognizing that you can do things on your own in your own community, but when you have those peers in similar communities where you can pick up the phone and have those conversations, that's really helpful for learning across. We've already talked a little about the policy systems, environmental change, the focus on that more sustainable piece of the work, and again, not saying that programs aren't just as important, but recognizing that for longer term sustainability change, how do we move there? Sustaining the work, this means more than just the funding. If a funder comes in and gives a couple of years, 3-4 years of funding, when that's pulled, what's next? But it's beyond that. It's more than just sustainability. It's sustaining the leadership, the collaboration, all these sort of pieces that feed into the others. And then the health equity focus. As we recognize that even within communities, there are neighborhoods of people that come from different cultures, different backgrounds, and how do you address those needs? And recognizing that health strategies impact people differently in different neighborhoods. So a blanketed approach in the Danville region isn't going to cover everybody. So you have to sort of have that community engagement, the constant feedback, to know that there are different cultures even within the community here as well. Anyone have any questions or quick reactions to these key ingredients right now? Okay. Anytime. And then based on those key ingredients and what we've talked about so far with our experiences, a couple months ago we just came out with 3 documents that share some of those. They're community examples, but also more the concepts as well. I think you may have seen the lessons for leaders, and it's a pretty hefty document, and I think there are pieces and parts that are a little bit more bite-sized, and we've got those that we're going to leave with you all as well, and they're free on our website as well. So now I'm going to hand it back over to Joanne.
All right, so the models and the key ingredients that Tim just shared that Active Living by Design has developed and really kind of form the basis of our work and our approach with communities and funders are drawn on experience, I think, but definitely we also wanted to mention that how many of you are steeped in collective impact or doing collective impact work? We wanted to put this up there because a lot of coalitions are moving towards the collective impact movement, and I think the foundation's moving in that direction too, and it's a really nice approach for keeping collaboratives accountable, I would say, and how they work together. So even when we look back at the key ingredients and we look at these 5 conditions of collective impact or collective success, none of these are like groundbreaking, gosh, I heard this for the first time, but we put these things up there because oftentimes, even though we know these things are important, when we get into the work, it's so easy to forget these or to forget one of these. And so we really view one of our roles is to make sure we're always asking you all these questions. How does this, are you still addressing health equity with this strategic plan? Are your strategies really sustainable in policy, environmental, and systems change, or are you mostly doing promotions and programs? So they're really important to stay attuned to because they can get lost quickly. So active living by design's models and approaches very aligned with collective impact in that model. The other thing that we're also going to continually keep a check on in our work with you is that we're drawing from evidence. So while knowing what has worked in communities and knowing what the models and best practices are so that you can tailor them to your context is so important. We also want to make sure that we keep abreast of the evidence and what has been proven and measured to have an impact in communities. So there are 3 primary documents that are listed here that have come out within the last couple of years that list the best evidence-based strategies for healthy eating, and they're also for active living. These are drawn from organizations like the Centers for Disease Control, CDC, and also Leadership for Healthy Communities, and others. And so these are up on our website, and we're actually going to delve more into some of these kinds of strategies around healthy eating and active living in the next couple of months and as you work on your work plan. I think the beauty of the process that you're in right now is that you're really on a parallel process. So while you're talking about what your mission and vision is going to be, and you're figuring out how you want to work together as a collaborative and how each of you and each of your organizations is going to get a benefit from being part of this group and then have also the benefit of working collectively, you're also going to be identifying some actions to work on. So sometimes it's hard to know chicken and egg, which comes first. Do we identify ourselves as a group first and then decide what we're going to work on? Again, I love how you're doing this on a parallel process, and I think one's going to feed into the other. So what we want to do next, now that we've kind of told you who we are, what we can offer, and the sort of models and evidence that we're drawing from when we do our work with you, we want to just share some stories of successful collaboratives. So the conversation today is really going to focus more on how to set yourselves up to work in a sustainable way. So we're really going to be talking about how to work together and sustainable collaboratives, and then, as I said, later we'll be moving more towards some of the content, healthy eating, active living stuff. So Tim's going to kick us off with our first community story.
And just want to pause again. Any reflections so far? We're good on time, and just want to.
We're going to get somebody to talk before we do.
Is this all repeat for everybody? A lot of what we're talking about as far as the process and kind of strategies, or is this stuff folks are some new and exciting ways to think about it?
I'll ask a question.
Yeah.
So what defines a sustainable collaborative? Like how do you, like I know you're going to come tell us about these 3 success stories, but like do you put a metric on that in terms of the number of years or the, like, I'm just wondering as you're kind of launching into these questions. I think I'm just trying to get some voices in the room, I guess.
Yeah, no, we appreciate that question, and I think, when we don't necessarily look at a defined amount of time, but for us there are some elements of sustainable coalitions, and we'll be sharing a framework after the stories to give you some examples of what that really means. And we're going to draw on your ideas too, like what does sustainable mean to you all? Because that's the more important question, right? But I think some indicators, not necessarily hard measures of a sustainable coalition, is one that doesn't stop because the grant funding ended. one that doesn't, a coalition that continues to function regardless of the frame. So, 15, 20 years ago, obesity wasn't the hot topic that partnerships were forming around, right? It was some other issue, maybe it was tobacco, but coalitions can live on and continue to do meaningful work despite the frame, the changing frame. I don't know if you had
Yeah, I
some
think
additional thoughts.
and just to, I think one additional thought, I mean, I'd love to hear what other people say to that question too. It's a good question. Is less reactive, much more of a proactive, of having a vision that you're always working towards, that is, always a little bit further. We did this, now let's go even further. You can sort of identify that and work together, rather than, okay, we checked it off, let's disband. So, unless of course that's maybe the objective up front. So, good question. Just to reiterate, these are just 3 stories that we wanted to share, and all 3 of these from Greenville, Louisville, and Hamilton County, which is where Cincinnati is. There are little pieces and parts that you might see the Danville region come out in what we're saying. None of these are exactly the same, and we recognize that across the board, and that's really what we want to bring, is to recognize and honor that there is a culture, there is a context, there is a history here that is going to be different from these places, but there are pieces that have worked and can be replicated as well. So to start, we saw that Annie shared with you all Live Well Greenville this past Monday and spoke with Matt Manley, and they were actually one of the Healthy Kids, Healthy Communities grantees from 2008 to 2013 that we worked with. And what we did was we put in bold here some of these ingredients. So we're reflecting back on the ingredients and how they checked some of those off. So they started with the Piedmont Healthcare Foundation, really launching this because of as a response to the tobacco settlement funds. And they had 3 anchors within the community that really also bought into it. It was the YMCA, Greenville Healthcare Systems, and then also Furman University. So between the backing of that foundation and these 3 really reputable, community members, they launched this coalition. It started as Activate Greenville in 2008, 2011. They made it much larger into Live Well Greenville. And what they did is they brought partners. They brought partners in a way that was very clearly defined for people that came into this partnership. They knew what their role was. They had 8 areas of focus. They have 8 areas of focus that they're working on. If you've checked out their website, just to make sure that I read exactly what they are, it's fun, before and after school, in school, during work or the workplace, worship, around town, in the doctor's office, and during mealtime. So if you think about those 5 Ps, or think about the different levels, you've got the individuals, you've got the organizational levels, you've got the community levels all in there. So when people came into the partnership, they said, yes, that's the area of focus that I can be part of. And it was clearly defined in that way for them, which helped bring new partners and know what the request was.
Were all the partners housed within Greenville?
Within Greenville County, yes.
Okay.
And that's another piece of their early work, was they focused in 3 communities. It was, Sterling, Barrett, and then Nicholtown as well.
They were within Greenville, right?
And within the
What
Greenville
about
County.
in Kentucky, were they all housed within that county or city?
The Louisville.
The three you had up there.
Yeah, the Louisville, because Louisville is a bigger population, and Joanne will talk a little bit about that, it was more neighborhood focused, but in terms of population,
within
it's
Louisville.
relative.
What about Hamilton
Hamilton
County?
County?
Because it was in Hamilton County.
Hamilton
everything?
County as well.
See, I think that's the dynamic here that's different. Is you have Pittsylvania County, Danville, you have Virginia Tech, Avery, you have Caswell County, you have several different localities, and that is to me that's the hurdle to get over, is to how do we all fit into this and work together towards something that's different from the 3 you have, is because they they were all
Within-
housed within, they all were in work focusing on the Louisville, Hamilton County, Greenville. Here, it's more than that. And so that's, in looking at what you're presenting and what we have and comparing and contrasting, I think that's the difference that we have here is making all that work.
I think, so within Hamilton County, thank you for that. I think that's true. Joanne's also worked with a foundation in the greater Cincinnati region that covers both multi-county and well as multi-state. So it goes in Ohio, in
Those,
Kentucky
to
as
me, those examples would be most helpful because how did they make it work? And, what's a best practice, not just within one locality, but within several localities, and what were their dynamics and how did they make that work?
well. Yes.
And I think, in particular, we got 3 governmental entities in there. However, within this group, such as
Right.
PASS, where I work, we're in each one, well, we're not in Castle County, but we're in Pennsylvania County, Community Services and across borders. So I think there's ways that we can blend
Yeah.
a lot of things. And Pennsylvania County, Castle County got the farms, Danville doesn't. There's a lot of things I think that we can bring together.
And
Yeah.
another piece this makes me think about is sometimes when you have similar or neighboring counties in that way, there's an opportunity for some very friendly competition, within whether it's municipal staff or some sort of government agency that's doing like a friendly, we can do better at this than you can versus, and seeing how that plays out over time. We've seen that as well.
Yeah, I'm not saying it can't work. I'm just comparing in my mind, your presentation to what we have and how it would differ.
It's an important point, and one of the things, when I talked about you all are operating on a parallel process, so, what Annie is leading with you in terms of identifying what your mission's gonna be, your value's gonna be, and how we support Annie and the foundation and figuring out what this collaborative is, how it's gonna function, and how you're gonna be organized. The point you raise is really important. Now, these examples are really more about trying to draw back on how the coalitions can function to address the key ingredients that we went over. So they're more for illustrative purposes on that. Your point is so important in terms of part of the work with establishing your collaborative is going to involve you all, and we're going to get into this later today, what each of you brings to the collaborative. And part of what each of you brings has to do with your own missions and your own areas of focus. With these 3 examples, I also want to mention that even though the collaborative was focused in work in a smaller region than you are, they had partners whose missions were broader than just Louisville, whose missions and target populations were broader than just Hamilton County. And they had to figure out, it's a question that a lot of collaboratives never ask. How are our missions aligned? If I come to this meeting, how do I justify when I go back home why I'm, only focusing in Hamilton County when my organization is focused in the entire state of Ohio? Those are real questions that, honestly, some partners have to justify why they spend time in meetings, right? And why they're part of a collaborative. So we're definitely going to need to keep that on the radar at that point that you raised.
And yeah, I think this is good. And one more piece to that I'm thinking about is, especially in government entities, about, when we think about the health equity focus that is in the key ingredient, if you've got an employee that is serving all parks, or all parks and rec, or all planning for an entire municipality, yet what maybe one collaborative might be focusing on is 3 small communities. It's the same thing. How do you justify that while also recognizing that your job or your role is to serve a much larger area? So that's at the much smaller municipal neighborhood level, but in some ways that's similar to what we're talking about here. So trying to think about, maybe we can put that on the bike rack and I'll pass it off to you, Joanne.
All right.
To take it back.
All right, anybody spent time in Louisville? Louisville, Kentucky? No. Okay, well, we're going to visit there really quickly. So again, this Louisville example is really just to kind of show you how a collaborative addressed some of these key ingredients of a sustainable and successful collaborative. So in Louisville, they had several years ago a mayor who was really about health. He really made that his platform, and he started the Mayor's Healthy Hometown movement. So this was an example of a collaborative that had a really strong political champion. Something for you all to consider as you identify strategies is, do you have political will around certain healthy eating and active living strategies that you can really, is going to take hold if you've got that political champion. Their collaborative was full of non-traditional partners. I think they even had like a county sewer district partner that helped with their community garden after they found out that the sewer department could provide the equipment to remediate garden soil that was full of lead. But the collaborative continues, I think that really important is the collaborative continues to engage new partners as their work changes, as their strategies changes, as other partners fall off, as different needs arise. They're always looking to engage partners. So another thing to consider as you're evolving as a collaborative. There was meaningful community engagement. So many of us do this work as part of our professional jobs. So important that the people that don't do this, that as part of their work, their professional work, but live in the community, work in the community, also have some skin in the game. How are you engaging them so that they really they're your eyes on the ground. They're the ones who really sustain the impact of the important work that you start. What they did in Louisville was they actually trained residents and more specifically youth on conducting community assessments. So youth went out and did audits of their neighborhoods to see if it was safe. They did some training to residents about zoning. It's not something that you just kind of know about zoning from living in a community, but actually taught residents what zoning was about and how that was important in impacting whether there were play spaces in their neighborhoods and whether there were markets in their neighborhoods, and then actually engage the residents to take their zoning training and influence the planning process. I talked about walkability assessments, and that was something that the youth was very instrumental in. So again, meaningful community engagement is something to think about in the strategies you identify. All right, so we'll move to Hamilton County next. And again, this is an example of where the collaborative really was intentional. They knew they wanted to focus on health equity, and health equity is so important because in order to really that's where you can get the most impact in terms of making change and improving the health within communities. What they did was, even though the city of Cincinnati is probably it is the biggest city in Hamilton County, they intentionally did not focus on Cincinnati, but they focused on every place else in the county outside of Cincinnati because that's where the greatest needs were. They have a multi-sector partnership that dovetails with neighborhood level community coalitions. So even though you're functioning on a regional scale, maybe this is an approach to consider where you as a collaborative are the umbrella organization that provides backbone structure, technical assistance to different parts of your region or to neighborhood coalitions that are in Caswell County or Danville or sort of the sub areas in your region. What We Thrive did was provide things like a common brand for the neighborhood level coalitions, training and technical assistance so that the local coalitions could have their own sub-action plans that would address their regions, their neighborhoods, but would still have broader impact because they were all under the We Thrive menu of strategies. So that's how they got impact. At each of the community coalition level, they trained community ambassadors. So they basically said, hey, if you want to be a We Thrive community, You need to identify community champions. You need to have some kind of, political leader on board who's going to support some of your policy changes, and you need to have residents at the table and engage your residents in training, doing things like conducting community assessments and then helping to actually implement an action plan. They have focused heavily on policy, environmental, and system strategies, the more sustainable things. So we know that promotions and programs are great because they engage people quickly in healthy eating and active living, right? I mean, if you have a big splash event where people are doing Zumba in a park, I mean, people are gonna notice and they're gonna get excited about it. If you do taste testings at a farmer's market, it gets people to try different foods that they may not try. But those things are really hard to sustain on their own because they take ongoing resources. And so we tend to focus on the policy and environmental systems changes because we know that those can create the underlying support to continue promotions and programs. But what We Thrive ended up doing was, again, the community coalitions could choose what kinds of healthy eating and active living PSE changes they were going to implement at their local level. But again, under the huge We Thrive umbrella, they could say 34 child care centers across our county adopted healthy eating and active living policies. 16 entities, schools, parks and recreation departments, adopted shared use agreements across Hamilton County. We've got 50 new parks and play spaces now because of all of the collaborative efforts of our local community coalitions. So again, we share these examples with you more to kind of start your thinking about how you might take the key ingredients of a sustainable collaborative and just have them play out in different ways and in different communities. So now we're going to make you all do some thinking and work and personalizing some of these models.
Yeah, so you have yellow Post-its at your table, or you should. If not, you can get around to finding them. And what we'd like you to do is, well, we're going to take a 10-minute break because we've packed a lot in so far. And it's a simple question that we have for everybody, and use as many Post-it notes as you'd like to answer this question in one word or a phrase if you really want to break the rules. How do you define an effective, sustainable collaborative? And write as many that come to mind, and then put them up here on this wall. Any questions about that before we break for 10 minutes, and then we'll come back. During that time, Joanne and I will take a look at what you've written, then we can talk about it and really get into some conversation. Okay.
And again, water back here. There's actually some coffee too, if anybody wants.
So I've got 10:53. So. What we're going to do in the next about 30 minutes or so, we're going to talk a little bit about these themes, talk a little bit about what we've seen as sustainable coalitions. Joanne's going to reference the framework in the back of your handouts. Hopefully everybody has those handouts. There's some more on the table. And then we'll go into maybe one more exercise. So very ambitious in 30 minutes of time. So just wanted to point out some themes that we grouped up here. We've got leadership and ownership, strategic, proactive, motivated, communication, trust, transparency, some commitment, long-term commitment, outcomes and results and impact here. Resources, shared resources came up a few times. Unified, accessibility and equitable representation from the community, and then also some flexibility, change, and adaptability. So it was nice to see that some themes came out. Any gaps or any themes that you assumed would be up here that aren't? This is it, huh?
Probably put funding.
Funding? No one said funding. directly. No one said it
Not
directly.
yeah.
Shared resources is
Yeah.
probably where it would be.
But that's important.
Yeah.
Yeah.
So we'll keep these here. Feel free to add, if you come up with others.
Yeah, I think what's really nice is that, while you were individually putting up how you think about sustainable coalitions, you're all pretty like-minded. We were able to get some themes, and there's no one lonely post-it note kind of off here, and nobody had any far-fetched ideas about sustainability that nobody else agreed with. So, I think.
Put those up there.
Yeah, it's encouraging that you're thinking about it in the same way, and these are sort of themes that we're going to keep revisiting, and particularly in the work that Annie's going to facilitate around mission and vision. That's going to be really important. I want to introduce you to our Active Living by Design's sustainability framework. So if you can turn to that last page where you see this full framework. And I'm just going to introduce the framework to you, and we're going to talk a little bit more just about the social stream today, but I do want to present the entire framework because eventually what we're going to be doing is looking across all streams of the sustainability framework to make sure that any healthy eating, active living strategies that you set targets around, that they're going to dovetail nicely with the social stream, which is how your collaborative is going to function. So again, this sustainability framework is grounded in actual community practice, and this is how we developed it. A lot of what the models that we develop is based on evidence, but then we look at what communities have actually done and what's worked. The way that this framework is organized is you'll see there's 5 streams of sustainability. So when we talk about sustainability, we're not just talking about resources and dollars, although that's definitely an important part. That's the reality of being able to be sustainable. But there are these other streams, the social, environmental, and policy and systems streams that are just as important. And all of these 5 streams really need to integrate nicely for a broad initiative to be effective and to sustain. So this model was also based on the triple bottom line, which comes out of the business world. Are any of you familiar with the triple bottom line? People, planet, profit. It's sort of that same concept of integrating not just financial resources, but human capital and environmental capital to create sustainable change. The way that you read this framework, even though it's laid out sort of in one-dimensional, the idea is that each of the streams operates on a continuum from left to right. Towards the left are example strategies that are maybe more reactive and less formal, and the strategies to the right are examples under each stream that are more planful, strategic, and intentional. Maybe more proactive is another way to think of that. With that said, we know the reality is that community context changes, so that while the intent is to always work towards strategies more towards the right of the framework, the reality is that political will may change with an election. There may be a natural disaster that interrupts the environment, and so communities in reality kind of loop around and back and forth, depending on changing context. But again, the idea is that it gives you some example targets to keep working towards the right of the framework under each of the streams. The examples that are populated in this framework have been tailored to healthy communities type of work and healthy community coalitions. So I'm going to give you a minute to look at the framework, think about how I just described the potential uses of it and looking at the examples, and then see if anyone has any questions just about the framework, the way it's laid out, or the examples. Any questions or comments? Anybody see anything on the framework or within the examples that jumps out at them as being particularly interesting, new or unusual, familiar? You all have been part of coalitions before, so I know you've seen some of these play out.
So I guess the reality of this, it's a very fluid, it's all those are in different places at different times that move independently of each other.
So yes to the first point, and it's a great point that, you know, it's not realistic to expect that if you're here on the environmental stream, you're gonna be around this area on each of the streams, but that the reality is some partnerships are really, really strong in their social capacity. So they may be very far on the right. So for them, you know, maybe that comes a little more naturally, or maybe their individual organizations just are very strong around social sustainability. So that might just mean they have to be a little more planful and intentional about moving these streams forward. And then depending on your strategies, you know, the economic stream, for example, if you're working intently on establishing policies and systems, maybe the economic stream doesn't have to be quite further along on the right, because you're establishing policies that won't maybe take ongoing resources. They don't function independently, and that's something that we're going to be here in the next 4 months to help you to integrate your strategies across these streams. So again, the parallel process that you're on with developing your coalition, mission, vision, and how to operate, we're going to work in parallel with developing some of these policy environmental strategies around healthy eating and active living so that they're integrated. Any other questions or comments? All right, well, let's take a closer look at the social stream. We have another handout kind of just blowing out those. There's 2 streams under the social sustainability stream. There's partnerships and leadership. And we split those up because when we talk about social capital, there's the, again, how does a collaborative operate and serve the best good of a community and residents? But then there's also, what capacity do you leave behind? So again, going back to the point of many of us do this work as part of our jobs as professionals, but when office hours are closed, and I know some of you are gonna laugh like, hey, my work's never done, my office hours are never closed. But what the social leadership stream really pays attention to, what capacity do you leave in that community? So you're not just there to create great policies, change the environment, but how do you affect the residents so that they can carry on the work and they can continue to engage in healthy behaviors in the community? So again, you'll see that with both of these social streams, the idea, you know, with some collaboratives, for example, with the examples on the right, they say, hey, we have this Healthy Communities Collaborative. If you're interested in health and you love your community, come on. And you know, just whoever's interested comes. You know, other partnerships, like with the Louisville example, they're gonna look for, hey, who's missing at the table? What strategy are we working on now that we weren't working on 5 years ago, and who do we need to engage now that we've got a different strategy? So being more intentional there. Another example is under the leadership is, you know, as we're working on healthy eating and active living, what kind of, how are we building each other's capacity? So each of you brings certain expertise and experiences to this collaborative. Are you all sharing that expertise amongst each other? So, you know, one of the best experiences I ever had was spending time with a planner and seeing a community through the eyes of a planner. I mean, I never knew that, you know, those medians in the middle of the road until I spent time with a planner, that those medians actually slowed traffic. There was a purpose beyond, oh, there's a nice strip of grass in the middle of a road. But those kinds of things, I mean, how do you build each other's capacity and do that shared learning? And by extension, how do you provide leadership opportunities for residents and the people who are living in the community so that they can, again, engage in and take on and sustain some of the work for you as the collaborative maybe moves to another frame? So again, I want to pause and allow you to read some of these examples. They're illustrative, they're not prescriptive, but just to give you an idea of what kinds of strategies might be more proactive and strategic. And I would love if a couple of people could just maybe take an example more towards the right of either the partnership or leadership stream and share an example from their experience of how they saw a collaborative operate in that way. What brave soul has a great example to share?
I'm gonna call on the ladies on the other side of the room. They will volunteer.
Is that me?
Yeah.
So I guess one example might be some of the stuff that we're currently doing with, it's called the I Choose program, childhood obesity program in the region, where it's trying to work from a systems perspective. So Danville Parks and Recreation, the Virginia Department of Health, the Children's Healthcare Center, and Boys and Girls Club. So just trying to build an evidence-based childhood obesity treatment program within existing systems and structures. And so we've been working on that for going on 2 years now. So that's an idea where we worked within the systems to build the program so that it could be sustained within the system. So.
And that's a great example too of not only systems change that tends to be more sustainable and have greater impact, but how you're building the capacity of the staff and the organizations within that system to really carry on that work. It's a great example. Anybody have a good example under maybe partnerships that, or a partnership that you've been part of that's functioned a little more effectively towards the right side? I think many of us have been a part of partnerships that maybe function more towards the left side, where you go to meetings and it's just report outs maybe, but any great examples of a partnership you've been part of that functions more towards the right?
Well, I won't take credit for it, but the Engage Coalition is something actually that started here at the foundation, looking at service learning and volunteerism for our higher ed students. And so now that's housed in our center at Everett, but it's a thing. We have members, we meet regularly, and we take action. So it's,
Great.
thank goodness, not come and talk about
Yeah.
what we might like to do one day. So
Good.
it's exciting to be a part of that.
Wonderful. Good. So all of you have some experience to bring, I think, in terms of how to operate on, more strategically and proactively as a collaborative. And so what we're going to do next is really kind of take your thoughts about what a sustainable coalition is, maybe using some of the framework example and some of the examples more towards the right of the social stream, to have a conversation about what each of you brings and can offer to this collaborative.
Yeah, great, thanks, Joanne. So, does everyone have this in front of them? Because I'm going to move to the next slide, but we're going to reference back to it. Okay, good. So, again, another quick exercise. We have a question for you that Joanne just posed, and you'll see note cards in front of you. And on those note cards, write two things. Number one, should be pretty easy, and that's your name. Hopefully
If
everyone
not,
knows
look at
that.
your name tag.
Yeah. Don't look at your neighbor's name tag. And then number two is thinking about this question. What do you bring to this collaborative that can help it operate more towards the right of the sustainability framework? And that doesn't have to be like a hard, tangible thing. It doesn't have to be a specific resource. It can be an idea. It could be a set of ideas. And there's no wrong answer to this. So write as many things as you think apply here. And we'll just take maybe a minute or two to do that.
And we just want to say that you're not signing
Yeah.
a lifetime commitment here. We just want to get an idea of something you think you can offer to the coalition, just so that you all start to get familiar with what each of you is doing and bringing to
Right.
the group.
Yeah, thanks, Joanne. This isn't meaning you're going to be on the hook to do that.
We're not
or
going to
bring
call
that.
you in 2 months and say, did you
Yeah.
bring that?
It's much more of just a brainstorming
It'll
exercise.
help us identify gaps potentially and, who's at the table.
This isn't a way of weeding us out, is it?
No, now that you're stuck here for life.
This is when you change number one, right? You change number one to someone else's name?
Yeah.
think the nice thing about this exercise for me is where I've done something similar in the past is that you don't always know what you even bring, right? You're like, well, I think there's that person over there that brings something similar to what I have. This is where you just think about you at your chair. Don't look around the room, think about what everybody else is too. And there might be some similar, different understanding of skills as well.
Tim, are they thinking about them as an individual or their organization?
Yes and yes.
Any of the above?
Yep. However people bring themselves to this room, whether it's as an individual or as an organization, as a
I
representative.
do think the organization part is pretty important too, because I think that's what brought a lot of you to the table. Yeah. And that will help us identify the gaps too, and perhaps other organizations that need to be here.
So I
But
see,
individual perspective is important.
Yep.
I see some people have put their pens down. We didn't call time, but that's okay.
Want to or not?
And I'm gonna
It's
stand
time to
here.
brag.
I'm gonna stand here in a very uncomfortable silence until someone else speaks.
Okay.
Yeah.
I think that something that we kind of, as Parks and Recreation may bring to the table is a lot of capacity, and the fact that there's a lot of initiatives into what we do with DRPHC and a lot of the community organizations. There's a lot moving already, and a lot that we can keep expanding on through this process and kind of help share with outside organizations and through this kind of spread that.
So are you, just to make sure we're clear, are you talking about staff capacity or?
No, I'm talking about as far as like programming capacity and the actual initiatives, and kind of research-based programs and stuff that are currently existing. Like we have a healthy eating and physical activity standards in our after-school programs and stuff.
So some policies too.
Right.
Okay.
Others? Yes. Thanks.
I work in the athletic department at Avery University, and we have some great facilities. We also have 350 student athletes that could possibly be great mentors and engage in the community. And within our department, we have two people that are very knowledgeable about health and fitness and nutrition.
Good. So expertise, facilities, mentoring. Great.
Okay. I saw another hand at this table. Yes.
We have a provider that's been doing a diabetes support group where for a year they exercise, they learn to cook right, lose weight, and like in last year, the group had lost a half ton of weight together. So it's some of the medical expertise.
Good.
Yes.
Compared to things the hospital can bring is, of course, medical expertise and also resources, not just locally, but regional.
When you say resources, what specifically are you
It
thinking?
would depend on what the project of the moment would be,
Okay.
but lots of resources, whether it's people and expertise, those kind of things. And then one of the things that the hospital has a really good understanding is about community perception versus reality.
So is that a potential connection to community engagement? Yes.
Great. I have my back to the room, but if anyone else just wants to go for it.
I'm a registered dietitian, so for Devil Public Schools, I have the nutrition experience that I bring to the table, the ability to reach the 6,300 students and the 1,200 staff members, ability to help shape policies for health and wellness in our schools, and also volunteer ability to implement some of these wellness initiatives that we want to take on.
The schools is a great venue to reach people, for
Sure, so, the foundation has been very generous to fund the Center for Community Engagement. Yeah.
Make you say that.
No, the Center for Community Engagement and Career Competitiveness, which is housed at Avery. And it's, sort of the umbrella for our service learning, volunteerism, and all community engagement activities, for the region. And so I was thinking about all three, higher ed institutions, and just tremendous pool of talented faculty and staff, but also the idea that we can mobilize 4,000 or 5,000 students, college age students.
For mutual benefit too.
Exactly,
Yeah.
exactly. So really in transforming the region. And then also thinking about, we have the commitment at the presidential level from all three institutions, and so how do you leverage that? And I love your idea of friendly competition, for the presidents to say, hey, our institution's doing this, or to a business, don't you want to be a part of this? So I think we could really leverage that too.
Great. Any of the themes that have now moved to the other side of the room that we talked about that aren't here but are at your note card, if you've made that connection? Yeah.
I think we have some evaluation capacity.
Does that include identifying target measures as well as measuring them? Great. Does that include assessment? Great.
Great.
Assessment.
This is good, and I'm looking at our time, and I feel like this is a good transition to the next piece of our work here.
And we just ask that you leave the note cards before you leave today. Either give them to Annie or Tim or myself before you leave. Again, not on the hook, but it's part of an assessment that we'll be doing.
Right, that's
to
the
learn
next-
more about to learn more about you all in the next month, so that again we can best support you in this process.
Yeah, this is our warning that in the next Monday email, there's going to be a survey link that we're going to put together, and we'll make it as painless as possible, just to learn a little bit more about you all over the next couple months. And what we'll do is next month on the 17th of December, we'll come back and just give a report out from what we heard.
We'll tell you what we learned about you.
Yeah, if you didn't already know.
We won't call anyone out. Aggregate.
Right, aggregate.
Absolutely.
Okay, so we're gonna transition just a bit into back to some of the conversations that we started to have last month. We just have a little bit of time, so I don't think we're gonna get into any, actually writing out our mission or our vision, but just a little bit more brainstorming. And then in December, we can spend a little more time ironing out those details and getting some of our structure and process a little bit more in place. But I just want to remind you all of the conversations we had. Oh, it's not doing that.
Oh, here, I'll work on that.
Okay.
You keep talking.
Of some of the conversations we had, we talked about the vision, and everyone threw out words. And I was excited that a lot of the same words were up here that everyone threw out at the last meeting. So was anyone at the tourism meeting that was last week? Or maybe it was...
Mm-hmm.
So the exercise they did around the articles in the newspaper, the headlines, were you participating? So I wanted to kind of replicate that, because what we really want to determine is the shared vision that we all have and that we can all get under with all of our various roles in the community, that we can all be behind this big mission. So the exercise is that think about in 5 years from now, I'm going to pick 5 years. What is a headline? You can think slightly long term, beyond 5 years if you want. What is a headline that you'd like to see in the paper that represents success? What success would look like for this group and for the community as a whole regarding health and wellness. So if you opened up the paper and it said blank, you could say, we've done it. We have really done a fantastic job. We've brought people together. We've accomplished some major things. So I'm going to give you a few minutes, and hopefully we can get this up so you can jog your memory of some of the conversations we had, to write on your Post-its. Let's actually have you, you can write on the Post-its, and we'll just have you post them on the wall or on the board. So take a couple minutes. And when you come up to post it, can I have you say it out loud? You don't have to, it's not mandatory. If you feel comfortable saying it out loud and posting it up on the wall. Okay? So I'll give you a couple minutes. And this is one of the Wordle versions of what we did last month. So these are all the words that you said. If we were successful, people would be active. We'd have resources, people would be motivated, informed, stronger, leaner, educated, unified, etc.
I actually had the Pennsylvania County, just like he did, but I'm not gonna say the world, I'm gonna say the universe. Let's step it up. Let's step it up.
Excellent. Yep. We got the healthy competition going already.
The competition. I'm all into that too, by the way.
Mine would be Danville finds a cure for healthy community.
Awesome.
I went with kids cut back, so in reference to sweetened beverages, weight loss, obesity,
Awesome.
have an impact on childhood obesity.
Thank you.
Mine is the Dan River region ranks in the top 25th percentile in the county health rankings.
Excellent. Thank you. That'll be next year, and then the healthiest in the universe the year after.
In
that.
5, yeah.
Anybody else want to share? Well, we'll keep moving, but feel free to keep putting your ideas up there as you go. Mark, you don't have anything to? Pennsylvania County has the most parks of any county, right? Yeah. So as you think about this, this exercise we had, we'd all just gotten together last month. Not a lot of people didn't know each other. You still don't know each other very well. Some of you do, some of you don't. But we just started throwing out words that might eventually come together to be a vision that we have for the future. So as you look at these words and you think about the headlines you just wrote and any kind of thought process you had over the last month, any observations, any thoughts, anything anyone wants to add, thoughts about this big vision that we can write for our community around improving health? Do these words still vibe with everyone? I'll give you a second to think. Oh, maybe 11. Lex?
I wasn't at the last meeting, so I don't know the sort of nature of that conversation, but I love the health equity focus that we're hearing.
Mhm.
I think we just, and I don't see that there, and I just would
Right.
love to see equity the biggest, because, until we can provide the same opportunities and resources to every child or every family, it's gonna be really hard to get to that. So I just wanna see that equity really as a
Very
big piece of it.
That's very important, and we're going to talk about middle border forward here in just a second. So, other things missing from this picture? Because I think what we'll do is I'm going to send out some things throughout the month and come with kind of a draft vision and mission statement potentially in December, and we're going to tweak it and work with it and make some progress next month. Any other thoughts on the vision? Okay, I want to have just 1 second for some feedback on the mission conversation that we had, and then we're going to do a little brainstorming activity about those short-term projects that we talked about we might want to work together on as we're going throughout this project. Yes.
Okay.
It was the Word document.
Yeah, I put it in a PowerPoint.
Okay. Thank you for doing that. So for those of you who weren't there, we did this exercise at the last meeting where we had on one side of the wall, very important, and on the other side of the wall, not important, and we had all these potential functions that this group could take on. And so we went, based on each function, we went to one end of the room or another, depending on how strongly everyone felt about wanting to do those functions. So we have a list of about, I think I took the top 7 that were all around above 4, I think, 4 to 5. Oh, sorry, it's not that one. Hi, Lori. Here.
I'll figure out how to get it up.
So I'm just going to look at it over the shoulder here. So the first thing that we came up with was supporting a self-organizing activities. And now thinking about that, I wasn't sure that does anyone have a clear way in their mind that they see supporting self-organizing activities? Could anyone put a sentence to that? I had a hard time doing it, so that's why if you all knew exactly what you meant when you ranked it the absolute highest function, I wanted to make sure I wasn't misrepresenting what you meant by it.
Say it again.
Supporting self-organizing activities. There we go.
Is that big enough?
Yeah. So I took a guess at what this.
The highest?
Yeah.
Were those the ones that were, we were commenting, right?
Yeah.
Those were written out.
Right.
So
I think what I felt like people were thinking was, oh, there's so much going on, we need to support what exists and have the infrastructure to support what individual organizations are doing, or with people, a plan of an individual person might come up with, or an organization.
I read that to say that we support, if people want to do something on their own, whether use a facility or have access to something, that's it. We don't have to create something for them.
Yeah.
Support open access.
We've created the spaces and the activities that they can choose themselves and don't need anybody to lead them in the.
Are you talking about individuals, or are you talking about?
I think, I'm with.
Okay.
I think we're talking about individuals.
Okay, well, I'm going to change that, because when I was thinking about it, I was thinking, okay, we're building a network, and this kind of speaks to it a little bit, building a network that if any individual organization said, oh, there's this grant out here, let's bring people together, but it's due next week. Let's bring people together quickly, and, this happens though, and, get it out the door. This infrastructure exists, that you could do that quickly and seize opportunities. And but I'm hearing you say that would also be for individuals having any of their individual activities, having a network in place for them to be able to know where everything is and to utilize any of the programs and facilities and opportunities that exist. Keep working on that, keep thinking on it.
Yeah, the word self makes me think of a silo though. So we're gonna be here, but then I'm gonna work over here in my little silo kind of thing. So that's what it makes me feel like.
Yeah. Anyone else feel that same way? Thought we needed to revisit that one.
For me, it's that the government's not trying to organize all these, or our committee here isn't trying to organize activities and things for people to do, but more people are doing it themselves, or organizations are coming up with their own ideas outside of the government, or
Like a community walking group, or, organized at a location.
So how does our group support that ability of that to happen? Just an example.
It might be through the provision of facility or space.
Right.
have walking trails, bike trails.
Okay. I think I understand a little bit better where you're headed with that. So we're getting to the culture of wellness kind of thing overall, where people have access to these things and they know where to go to find them and who can provide them.
And not that every organization doesn't have their own job in there. For example, the farmers market's gotta be operated by somebody, but people would know it's there to come and get the healthy vegetables and everything. Or the walking trails and the athletic leagues. But it just empower people to live a healthy life.
Okay.
That would just barely made it as the top rank. The next
That's
one's
true.
much easier.
Okay, so let's move on. Number 2, joint messaging campaign. Is that one that's at the top still for everybody?
Yeah.
And as you saw from all of the communities that we looked at in the last month, they all have a pretty solid, and all the communities that were presented today, they all have a brand, and they all have their fingers across the community in a lot of different organizations and community goals. We're good with that. Is that number 1? Maybe. We'll keep. We don't have to make any decisions today. Develop collaborative programs. This is number 3. Same, I think it was, I took the numbers off of it, but I think it was also a 4.5. I think there are discussion around a lot of different early childhood and worksite wellness and these potential new programs or opportunities that need to exist.
Can can I just say, Annie, I think if we all have a joint messaging campaign and we're all putting forth the same front, that everything else just falls under that, to me. You know, the collaborative programs, we have the same message, when we go out into the community. So to me, everything else falls under that, so.
I would agree, and I think that's the way the exercise is kind of built, that
Okay.
your top ones, all the bottom ones feed the top one, and everything all the way down the list could happen at times, but would all be in order to support your top 3 goals, for example. Yeah, I agree. We still think that the group would be
I kinda have
assisting
a
in the
question,
development?
maybe this is where maybe I think the living design could help out, is in other communities, when you've done stuff like this, does it work out more to focus on building the capacity and the services that people provide? Because we've talked about how many people have different resources to bring to the table, but in communities where y'all have worked, you know, is it better to focus on the things that are already going and help share that across the board versus trying to collaborate? Like if we said this is what we're gonna do as a group, and you start a whole new initiative, it takes those resources away from the existing ones. So I'm kind of just thinking in that role, like how have y'all seen that work in communities where focusing on new versus what's existing?
Yeah, so some of this conversation, and I agree with you about, you know, the branding and the messaging, I think is something that a collaborative can really help, and it trickles down to the local community. So with the Hamilton County example, you know, they had that We Thrive broader branding initiative with some infrastructure support to then tell the local coalitions, hey, here's the menu of the evidence-based strategies. Choose from this menu so that across the region or across the county, you've still got some collective impact, so to speak, even though the local coalition strategies, which, you know, an analogy for you all might be what your organizations are working on, still are aligned really well. So that's my thought about how this seems to be shaping up. You know, in terms of whether there's gotta be some reason why you all come to the table. You know, a collaborative really doesn't need to exist if you all are gonna go off after these meetings and do your own work. But so what is the service that coming together can provide? And I think that's what you're trying to identify here. You know, I think it has to be a given that you all are here because you're doing great work within your areas and aligned with your mission, and that, you know, we know you're gonna continue to do that. But part of our assessment is gonna be to help figure out and communicate across you all what those things are, so that you can fit it into some other overarching collaborative. I think there's a lot of power in this group, particularly because you are trying to extend beyond the region, and even if you're working in, you know, the city of Danville or in Caswell County, there's cross-learning and things you can leverage across the region.
And different communities are in different phases of
Yes.
access to facilities, or, you know, I'm growing a Parks and Recreation Department in Pennsylvania County and trying to get facilities. You know, Bill and Danville are in Parks and Recreation a little bit different, or a lot different scenario than I am. So, you know, to me, I see this as, if this is a collaborative group that can take hold, it can help me generate funding, not just from grant opportunities, but also as a collaborative approach to go to, you know, board of supervisors and things like that. So, you know, just a lot of different, and everybody has their own, you know, like we talked about earlier, it has their own thing they're looking at when they come into a group like this, especially one that spans such a large region. But, you know, when you talk about having facilities and more of the programming aspect, I think of it more as getting facilities and then working on programming. So it's it spans a lot of different
And building
things.
off of that idea, because you've got this regional spread, you know, you being able to go back to your board of commissioners and saying, but hey, our neighbors over there have facilities and we're struggling to get facilities, and here's the impact that we're already seeing in that community. You know, being able to share and leverage that way can be another powerful goal too.
So I think we're gonna be looking at the programs that already exist and the things that are already going on, and that's what I would love to do the next month. We've looked at communities that are doing similar things in Accessible the last month. I think we should look at what's currently happening here and what we can build on, and what capacity we currently have. So I think that certainly it makes more sense to take things that are already going on and build them and bring more partners to the table around them. I think that would probably be something that the group would agree on. Okay, so I'm going to go through the rest of these really briefly, and then I want to do an exercise before we leave, so don't too many of you sneak out of the room. Foster support within member organizations. I think this is an important piece to the puzzle. We all agreed on that. Any comments on that one? So making like kind of the health and all policies approach within our own organizations. Generate innovation in the field. We have the opportunity to jump on some maybe new ways of looking at things, and we have folks who are able to evaluate that, so we can maybe try some new approaches and see if they work. Still like that one? Learn together as a group and advocate for specific change or specific issues. I know the planning folks can't do it. They were on number 3 during all those conversations, but we'll advocate to you for specific changes. I've already been bothering Ken for a few things.
It's a lot of bother.
Thank you. Okay, so I'm going to take and tweak some things, come up with some critical functions, and also just do kind of a draft of a mission. We'll look at lots of other missions at the next meeting, depending on what we decide to do at the next meeting after this. And then we'll start really getting down to a mission and a vision. And I think the name will be maybe the next step after we really decide what our goals are. So any thoughts on the name? Anybody have any wonderful, brilliant ideas in between the last meeting? For those of you who weren't there, we decided there's Dan River this, Dan River that, Dan River everything, and that we don't want to be the Dan River Health Collaborative or the Dan River whatever. So we liked the Thrive. We liked some of those one-word names that we could really that could show not only the name of our organization or the name of this movement, but that vision that we have as well. All right, next time we're going into more detail on that. Okay, very last thing I want to do before we leave, and then I'll see if Tim and Joanne have any final thoughts after that. We had talked about a short-term project that we wanted to maybe make sure that we're working towards other goals at the same time that we're doing this kind of longer-term planning process. At the same time, are there any folks, Middle Border Forward, folks who are involved in that organization? Anybody else? So my coworker Wendy has been working with a group called Middle Border Forward for the last 18 months. Is that right, Leslie? Maybe a little bit longer. To look at a long-term vision for the region with 50 folks aged 20 to 50. I'm brought in, I don't have. They've come up with a vision that they're going to be sharing with the community in the next month, and getting some input and trying to come up with a list of tangible projects that could be potentially done in the community, kind of more long-term but really tangible things. Like we saw this happen in Dubuque, and they had things like a community health center in this location, expanded mental health and substance abuse programs. They're very, like, we know when we have accomplished that. So it's kind of very tangible projects. Middle Border Forward has come up with a vision, and I'm not going to read this to you, but we can send it out as well, around access, initiative of individuals, community engagement, leadership development, trust, diversity, and organizational responsiveness. So this is really the health equity focus that Alexis was talking about earlier. So when we're going to brainstorm on some short-term and long-term projects, when you think about that, try to put it into this frame a little bit. So, are we addressing folks that are of the highest need? Are we building leadership across our community? Are we engaging everyone? Are we really part of an inclusive process? Okay. So what I'm going to ask you to do is think about project in the next 6 months. Something that one of your organizations has going on, something you know is coming up, something you just think is a cool idea that folks could work together, starting within the next 6 months. The other piece is something more long-term that could be a 5 or even 10-year goal that has to do with the health and wellness of the community. So I'm going to start just to give some examples. And for long-term, I'm going to say a local food co-op. Conversation with folks. This isn't sticky, just realized. Thank you, Tim. I guess I should put long-term on there. And then we also have a project starting up called Healthy Spaces that I think I talked about a little bit at the last meeting with the Center for Community Engagement and DRPHC and Get Fit and lots of other folks will be involved. That we're looking at vacant lots in some of our communities and engaging community members around revitalizing those vacant lots to create healthy spaces. So that might be to promote physical activity or healthy eating. So I'm going to put healthy spaces on the short-term board. This is a total idea blitz. So anything that comes to mind, it can be completely crazy, it can be, you know, out of this world, or it can be very feasible to do tomorrow, whichever way your brain is heading. And I'll have markers. So everybody, 1, 2, 3, go.
I was thinking maybe like a bike or walk to work day type
Okay.
thing, although it's gonna be cold now.
We can work on it for this one. Work, school, kind of.
Yeah.
We have that national, you can join.
Well, we could do a community one.
Well, we can partner with the national one, part of that thing promoted.
Is there a day in the spring? Okay.
September.
I know there's one in October, but there might be.
Spring is Bike to School Day.
So there's bike in the spring and walk in the fall.
That's right.
We can tweak it.
I think it's May 6th, I think.
Okay.
You do a motorcycle work day, and we need council to actually proclaim it, and it gets some press and everything else, so that's something possible.
Yeah.
I know under the Engage Coalition, there was Day to Engage, but last spring it was Play to Engage, which was more of the healthy community, which I know a lot of the people in the room are a part of. So
Yeah,
maybe
so-
it's making that a bigger event, and whether you recognize it, if you have any set in place.
Yeah.
then it can maybe be at one of those locations to promote that.
Should I call it Day to Engage? Or Play
Yeah,
to
but
Engage?
the spring one was a Play to Engage, it was called.
Okay.
So it was more of the healthy lifestyles.
Great idea. Short term? And I'll let you all come up individually at the end here as you walk out, so. What about big projects? Big stuff. What do we need? Big tangible things.
I'd love to see a mobile farmer's market.
That doesn't necessarily have to be super long term, but it could be.
Yeah,
It could be
I mean, we
even.
can do it on the back of a truck.
I'm gonna
or
put
a
it on
cheese
both.
market, but we're not seeing people use our farmers markets, the underserved community, like we hoped. So taking it to them might help. And that's part of our Day to Engage activities with the center. So we've been doing that with the athletes.
Oh, have you been going out with fresh produce? Excellent.
With recipes and, yeah.
Very cool.
Childhood obesity initiatives.
Long term? Short term?
Crosses over, I think.
Can you name a specific?
Like we're working on, there's a healthy eating and physical activity standards that the National After School Alliance has put down, so jumping on that and kind of sharing that with the whole region and how that works out.
All the other after school
Yeah, instituting
programs.
policy changes in any place where kids are out of school.
You know what that, I'm gonna put it on both. I told Wendy I'd have at least 10 on the long term, so y'all better go throw something up here before you leave. Cause she's gonna vet this out, she's gonna take it out to the community and have a lot of other folks weigh in also. Long-term projects? Marcia, I know you're working on some community health worker initiatives. Is there anything around that?
It's in the beginning
It's in the
stage, but
beginning.
it is a possibility, community health workers that actually are from the communities that are trained to work with the local residents in the health initiatives. And they work with the doctors. You know, they're the liaison that goes into that community that maybe has the people that are diabetic doing a walking club or need to follow up on some of their health concerns.
You combine the play to engage and set up the mobile markets at some of the parks to introduce people to healthy options. As you have a captive audience somewhere, so you combine several of those.
Play to engage has a good opportunity to combine quite a bit of what
So for me, it's long term, but trust.
Oh, that's true. On either side.
For your long term, should you get a park in the county?
That's what I said for me, it's long term. But thanks for recognizing.
It's not listed up on there, that is.
Yeah, you didn't say, you didn't.
Well, look at the time.
Large state, we don't have anything.
Yeah, you did not put that on your, as a goal mark.
So I think maybe, Annie, because I agree with that, related to what Mark said, parks or healthy spaces within X amount of all residents, that could be a good long-term initiative where all residents, county or city, would be within whatever definition you want to say, half a mile, of a park, a trail, or some sort of facility or place they can go to be active.
So is the play to engage, is that like a get out and get moving kind of, is that something existing, or is that the name?
It fell under the day to engage, so basically one every semester for the last 2 years, I think it was. So this one was the fourth one. And then last spring they did it as a day to engage, and it was mainly for the youth in the area, and designed around community service project for the 3 schools, so either DCC or PCC, to get out and do the community service. But it was more of the healthy lifestyle, so there was activities for the youth to do, and it was held here in the pavilion. So it was a central location, and throughout the day there was some education pieces as well, and healthy produce type stuff. So it was community service based day for the 3 schools, but it was designed on that healthy lifestyle.
Lori, do you have any short-term projects coming up? Stuff that's happening?
I mean, I think there's always opportunities to do, and it's kind of play on what was done last year with the weight loss. And I think about coming up on the New Year's resolution, you could always do, again, we might not lose 50,000 pounds, but,
I think to piggyback on that would be like a more long-term worksite initiative where, if you're incorporating the challenge aspects of it too, but even things like, you spend 40, 50 hours a week in your worksite and yet you don't get access to physical activity.
Worksite bonus program.
And so kind of to piggyback on that, I also think there's need for treatment programs. But, I think you can think about it from a prevention model, and that's important, but there's also a lot of
Like the
folks
diabetes
living with
initiatives and
Pardon?
the diabetes initiatives and.
Yeah, like obesity treatment or chronic disease treatment. It's kind of more of a medical model, but
Any specifics you want to add to that piece?
I was thinking obesity, but I think it's all related to, weight-related chronic diseases.
Excuse me, access to nutritional counseling is not something that everybody has, so that would be really helpful in that situation.
Well, and piggybacking on what Stacey said, it'd be great if we could have some sort of access to a community kitchen to provide demonstrations and, with the local food co-op close by to that so that people can actually see what to do with this food.
And I think,
Yeah, exactly.
I think you could probably partner with a lot of the churches in the neighborhoods, because they are the central, basically the atom, the nucleus to their neighborhood. So, they're going to provide, yes. So they're going to not only provide access to the members of that neighborhood, but also, be a central location you could hold something like that.
know,
Excellent.
there's some good kitchens in some of those churches. I think also, some of the work that we're working on with the task force is, nutrition education in every grade, and to go along with that would be a community garden at every school, so.
Long-term, I imagine.
We actually did a community